Hello, listener, and thank you for tuning in to the We Should Talk More podcast. In this episode, my guest shares the story of her first child being diagnosed with the vein of Galen malformation. VOGM is an abnormal arrangement of blood vessels in the brain that develops during the first trimester of a pregnancy and can lead to heart failure and hydrocephalus. The condition generally requires treatment before the affected child's first birthday, but every case of VOGM is different. This condition is notoriously difficult to diagnose and treat, and for Lena, as well as other families dealt this terrible card, the prognosis is usually grim. Lena speaks candidly about her own daughter being diagnosed with VOGM, the years of treatments that followed, her eventual cure, and channeling her experience from this painful journey into co-founding a nonprofit organization that now helps families around the world. If you could please introduce yourself and just tell me a little bit about who you are and why we're speaking here today.
I'm Lena Spisak, and I'm a working mom. I had my first child at 32, I think. Mm-hmm. And so I guess I was a little bit older, but the pregnancy was fine. I had a lot of swelling. I don't think that was related to her, but it always makes me wonder because just the processing of fluids and stuff, that like one of the reasons, so my daughter has a vein of Galen malformation, and it is a structural defect of the vascular system in the brain. Okay. And one of the ways that she was diagnosed was because of she didn't process amniotic fluid correctly. It caused me to have my amniotic fluid to increase more than it should have towards the end of my pregnancy. And that's called polyhydramnios. And half of the time it's totally normal. But half the time it's a sign of neurological or gastrointestinal problems. And for us, it was a sign of her problems. And so that always does make me think back to that swelling, because it's like, well, what if that was related? But it seems like every pregnancy is different for these kids. There doesn't seem to be any hallmark symptom where you're like, my kid has this. But yeah, I just think back to that. But otherwise, it was a normal pregnancy. I mean, I was irritable, but that just might be my personal style of pregnancy. Yeah. Yeah, at about 34, 36 weeks, they did notice that my stomach was growing off of its growth pattern. Okay. And so they just told me I had to come in a little more frequently to get measured. And at 38 weeks, they decided that they wanted to do an extra ultrasound to see if anything was going on, because my stomach was still increasing past the growth chart. Mm-hmm. And they did it, and the doctor looked concerned and asked if I would go to a specialist, like a neonatologist and high-risk OB, to get additional ultrasound the next day. And we did. It was late in the day because they just squeezed us in. And my husband says I need to forgive this lady, but I don't know if I'll ever be able to. And even though she didn't do anything wrong, but the ultrasound tech, she was grumbling about having to do an ultrasound on somebody that was 38 weeks pregnant, because she was like, why don't they just deliver? And then my daughter's ultrasound pops up on the wall, and there's a giant black spot in it that's off center. And it's obvious, like the little I know about brain anatomy, that was not supposed to be there, because it's supposed to be symmetrical. And the lady just got quiet and left the room.
She just got quiet and left the room. She didn't address this
because she's not allowed. The techs aren't allowed to interpret.
Sure. Okay.
The things, but like usually there's some small talk.
But but there was no small talk. She just opened it and then.
Yeah, I mean, we all looked at it for a second and we were like, I mean, I think all three of us, because my husband was there too, all three of us just knew that, it wasn't supposed to look like that. Mm-hmm. And then we had to wait a little while because there were still other patients in the office before the doctor could actually see us. It wasn't long, but it was the end of the day.
Mm-hmm.
And she came in like already crying, not hard, but tears, and said that a friend of hers about 20 years prior had had a child with it. And didn't say what it was. I think she called it, I don't know, a brain aneurysm or something. I don't remember the terminology, but it was not the diagnosis. She just
Mm-hmm.
said it was a type of whatever. And said her friend had had this 19 to 20 years before, and then Dr. Ben Carson had tried to operate it because he was a well-respected surgeon, and the baby died on the table. And so we're just sitting there, like, and I
And
can't.
this is before the doctor came in to speak
No,
with
that
you.
was actually the doctor at that
Oh, that
point.
was the doctor.
Yeah, finally.
But what a way to relay
Well,
information.
yeah.
That's wow. Okay. And
Um,
this is a doc. This is the doctor.
in Atlanta, at the hospital in Atlanta that has the most high risk pregnancies and births. So this is like, I mean, there are excellent doctors all over Atlanta, but she specifically dealt with high risk stuff, so she'd seen a lot. Um,
So this doctor is telling you through basically tears of
yeah,
how she has seen this work out prior.
yeah.
How are you processing this? I can't
I
even
was
imagine.
We were just in absolute shock because I mean, I was a little bit older, but not much. And we'd had no other concerns with the pregnancy. We'd done the genetic testing. Um, and it was just a lot.
Yeah.
I have, I mean, because she also told us there was a less than 1% chance of survival. And if the baby was going to survive, that she would be essentially a vegetable. Um, and so, I mean, we've been very cautious with our optimism because of family history of things. Nothing that would make us expect, a baby that wouldn't be viable.
Yeah.
But just cautious. We waited to name her a long time. Um, and we finally decided to name her after my husband's mother, who had coincidentally died of a brain aneurysm in 2005. So it was like
Wow. Okay.
that day, I mean, it was horrible. Like, I mean, horrible doesn't do it justice. But it was just, I mean, I don't
I
even
mean, I
know.
imagine you'd be absolutely crushed, and
Yes.
not to mention the not only the news itself, but also the way that it was delivered to you in the least professional way possible.
Yeah. It was
So the
literally,
combination of
yeah,
all of that.
it was world changing. Like, I don't know how to say, but it's like we were living one life and
Hmm.
then it immediately shifted. And my husband and I think we're fairly, I don't know if pragmatic is exactly the right way, but we had some really hard conversations on the way home and that night. And it's just like, well, because they told us we'd have to deliver by emergency C-section the next day. Because I'll go into that in a second. But so back to the conversations, it was just like, we decided that we're in it for the long haul. We weren't going to let this affect our relationship. We were
Hmm.
going to, if our daughter did not survive, we were going to continue to try to have children. Like, had we discussed all of the scary things that can be associated with the loss of a child. Um, and and if she did survive and she had serious issues, we still decided that we wanted to have more children. And just all of that. And after that, I think we were a team and decided, we were just whatever may come, we'd get through it.
Just gonna figure it out. Okay.
Yeah.
So they told you have to deliver after this the next day by C-section.
Yes.
What are they telling you in terms of what can you do about it, if anything?
They didn't know. They had only seen in Atlanta. I don't think that doctor had ever seen one before personally, other than having
Okay.
that experience, that secondhand experience. Like, she hadn't seen one professionally, I guess. She'd seen it
Okay.
personally, but I mean,
Okay.
almost 2 decades prior. Um, and so I'm pretty sure she said she'd never seen one before. And we heard that a lot from doctors everywhere, that they had never seen this condition before. They had heard of it theoretically, but some of them didn't even remember hearing of it. It was just, I mean, we realized at some point, and I can't even remember when, but a doctor was talking to us about something, and um, we realized that they were quoting Wikipedia to us. Yeah,
Like
and
things that you read, things that you
yes,
looked up and read.
yes,
Okay.
and so it's just, like I said, it was just eye opening and perspective changing, because at this
Mm-hmm.
point, this person, we're in Atlanta. It's affiliated with, most of her treatment and care and stuff was affiliated with Children's Healthcare of Atlanta, which is
Mm-hmm.
probably the top children's hospital in the Southeast,
Okay.
and called CHOA. And I mean, we were very happy with our care there, so I'm not saying anything, but just it was so rare that even after she was born at the NICU, they said they'd maybe seen 3 or 4, and the outcomes had not been good. And they didn't specify whether the child had died or just had severe um, dysfunction.
Okay. And at this point, they're
Right.
saying to you, it sounds like they're saying to you that this is an aneurysm, right? They
Yes.
don't know, they're not giving you the actual name for the condition. They just think it's something within the realm of
Yeah.
a brain aneurysm. Can you talk to me about what happens next?
Um, I do want to say that we did end up diagnosing it ourselves through Google by searching for fetal brain ultrasounds, and the one that looked the most like what we saw was the vein of Galen malformation.
Wow.
Um,
Google gave you more medical help
yeah, then
than
that
the
might be.
actual doctor in a
Yeah,
hospital. Okay.
yeah. I mean, that is a whole nother story that I should talk about with Marlena, but we did follow up with her. um, but so delivery, it was just we. It was late in the day on Tuesday when we found out, and we texted. I mean, we didn't want to call them. We did not want to talk,
Mm-hmm.
but we texted our family members, and it was really wonderful because pretty much everybody showed up. Like my parents, my sister, and they lived 5 hours away, and my husband's sister and brother, and they also lived hours away. And then my aunt, an aunt and uncle too. And it was just, we told them they didn't have to because like we didn't know what was going to happen. We had no idea of like the repercussions, but they ignored us, and that was, I guess, good in this instance. But it was really hard because there is nothing like a depressing delivery room. Like everybody, all those people were just standing around us silent because we had no idea if we were going to bring home a baby. It was incredibly hard. I literally, there just aren't words to describe it. Just the worst imagination, but go farther.
Yeah. Yeah.
But the actual, looking back on it, it's like ironically funny to me because your sense of humor changes when you've
Mm-hmm.
been through stuff. But I
Sure.
do remember, because in the C-section they've got this sheet, but it's only probably a foot and a half tall, so you can see some stuff over it. And I remember them lifting her up, and they said she'd be about 7 pounds 11 ounces, and she was 9 pounds 3 ounces, so
Big
really
girl.
big.
Yeah.
Um, but she was purple, and as they lifted her up over the sheet, it just reminded me of Free Willy, like when the whale jumped over the wall because she was so big. The purple actually wasn't good. She did have
Okay.
pulmonary hypertension at birth, but
Mm-hmm.
luckily it did resolve. But it's just, it was, it kind of highlights what a surreal experience it was, because literally 24 hours prior to that, we were just expecting a baby,
Yeah.
like completely unaware of how our life was going to change. Um, but it was okay. I can't, I mean, my husband I don't remember if it took her a second to cry or what, but there were a ton of people in the operating room as well, just
Mm-hmm.
because they had, the NICU people, like cardio people, respiratory people, like everybody, to make sure that she had the best chance of life immediately. Because that's the other thing with vein of Galen babies. So the structural issues, it's essentially, it's like they're supposed to be these much smaller capillaries and other, vessels that take high pressure blood and slow it down to low pressure blood to pass it back through your heart. So your arteries have a whole bunch of high pressure blood, and then it gets slowed down by this network of vessels to go to low pressure blood to your heart. But in a vein of Galen, they don't have so many tiny vessels to slow it down. They have much bigger ones, and they're malformed, so it doesn't slow down that blood. And so at birth, I can't remember the percentage, it might be around 50%, these babies have all this high pressure blood just bearing down on their heart, which can cause them to go into heart failure during delivery because of the other stress. And it's just the baby's heart was not built to handle that level of blood being forced into it. And so that's why there were so many doctors. Luckily, my daughter was not one of the ones that was in heart failure at birth. That's a very common situation or scenario for these kinds of kids. But the other one is that high pressure blood and the size of them can block up the drainage system for cerebrospinal fluid. Okay. And so it can cause that to build up and cause hydrocephalus, and which obviously eventually would cause brain damage, and it changes the shape of the skull.
So this is the fluid building up inside the brain. Okay.
Because of the enlarged blood vessels from the vein of Galen malformation, it blocks the drainage system for the brain fluid. Okay. And so those are the two. Some unfortunate children can have both. Like Mary Catherine mainly just had the blockages of the cerebrospinal fluid, or the CS fluid. That is a little safer because you can wait longer.
And this is something they only find out once the baby comes out, right? Or do they know this while she's still inside?
Daniela was actually lucky because they know in New York. Okay. Because it's like a hub for vein of Galen kids because of Dr. Berenstein and Dr. Fifi and all the people at Mount Sinai. And so she was just way more informed than we were because of where she was. But in Atlanta, they didn't know. They had no idea what to expect. They're expecting the worst. And like I said, this is not some regional hospital in a small town. This is, I'm pretty sure it's like the largest children's hospital in the Southeast. I could be wrong about that, but it is a like well-respected medical facility. And yeah, they just didn't know. So she was in the NICU, and we were just waiting and watching. But I also remember, and this isn't related to the VOGM stuff, but I'd forgotten to keep pressing the pain meds. So when I finally got to hold her, because they immediately took her to the NICU and to just evaluate her and stuff. But so they thought she was stable enough for me to hold her, and they wheeled me down there, and it had been just long enough where the pain meds had worn off, and I could press it, but it doesn't come back. And so even when I got to hold her for the first time, I was like in excruciating pain, and there was, I guess I was on some level, I was glad to hold her, but it was just like I was in so much pain that I didn't even it didn't sink in the gravity of it. I couldn't appreciate it because of this pain. And then they had to take her because the hospital I delivered in was not the one. They didn't have a permanent NICU. They had essentially a staging area for high risk babies. And then they medically transferred her to the children's hospital with the NICU. Yeah. And then, eventually the medicine kicked in, but she was gone. And then, I didn't.
How long did they let you stay with her?
Oh, it was 15 minutes or something, maybe 30, but you know, but they had to get, I understood, they
Yeah.
had to, they did not know how stable she was, and they had to get her somewhere where they had the equipment in case there was some kind of emergency.
Mm-hmm.
Um, and I didn't get to see her for 2 days because I had a C-section and I was in this other hospital. But like I said, we had so much family there. Everybody was going to visit her. My
Mm-hmm.
aunt at the time was a chaplain at that children's hospital. Um, and
How old is your daughter now?
she's 6.
She's 6. Okay, so you
Yeah.
had her before the pandemic. I was wondering if
Yeah.
this was happening during.
No, it's
Okay,
2017.
got it. Okay, okay.
Yeah. And it was so intense. There were so many aspects of it, like that were just so intense.
So now you're laying in your room. After you had delivered your daughter, they took her away. I mean, I'm sure you're like constantly asking for updates, for information on what's going on. What are they saying to you, if anything?
Nothing. I mean, just this is another thing. They didn't press me to start trying to pump. And it was my first baby. I didn't know anything about it. I think everybody felt bad for me because we had no idea. Like the expectation was my child was not going to make it. So nobody was like, "Hey, you need to get on this breast pump and, start trying." And I really struggled with nursing her. I mean, she also had thrush. So there were other issues, but I just never built up the supply. And I think part of it is that, you know, you really need in those first few days, it's so critical to really start trying
Mm-hmm.
to produce milk and stuff.
Yeah.
And I mean, we are also under such intense stress. Um, that's what I was just kind of in shock. Like, what do we do? Is she gonna live? You know, I don't know. Um, we were just so incredibly scared. Just
Yeah. Just the very fact that this is your first time having a child, and then all this stuff gets sprung on you within like 24 hours, and now
yeah,
you're thrown into the deep end and you're not getting information. I can't even imagine how terrifying that must have been.
yeah.
How, okay, so then do they, how do they end up releasing her from the hospital? Do you guys end up going home together?
No, I got released. She stayed. And it's weird how these things they blur. I can't remember if she was in the NICU for 9 days or 11 days, so not a ton of time.
Okay. Okay.
Um, but I got released, and of course, the first thing I did was go see her.
Mm-hmm.
Um, and the NICU nurses actually were some of the first people to make me feel like she had a chance, because they told us that they loved taking care of her because she looked so big and healthy, and that she, you know, they all believed she was going to make it because, in the NICU they see just incredibly premature babies.
Yeah.
Um, and Mary Catherine she just looked so healthy.
Okay.
Um, and that really was wonderful to hear. And I don't know, it was just so scary. I don't, like she was so little and she always was like being pricked and had like lines and leads and IV tails, and
Yeah.
it was just so scary because we were first time parents and we were scared anyway. Um,
So one of the things I'm sure you're experiencing at this point is, between this lack of information from the doctors, you don't have anybody in your life who is going through something like that or has gone. So you personally have nobody to turn to even ask for like advice. How are you navigating these next few days?
my husband and I were lucky that we really did turn into each other.
Okay.
And we didn't, I wouldn't say that we're big like talkers in that sense, but we knew because we were both going through the same thing. And so we didn't talk about emotions a lot,
Mm-hmm.
but we were both very forgiving of each other and gave each other a lot of just grace
Yeah.
to, you know, try to do our best to do what we were supposed to do. But unfortunately, on some level, I did have somebody. My cousin, he was a good bit younger than me, 9 years, or was it 11? I know this sounds terrible. My numbers, just everything, like, he actually had committed suicide about 2 months prior, and he was 21 at the time.
Okay.
And so my aunt, she had just lost her son, and you know, so it was different because, I mean, in the beginning we didn't have any hope. Like, they gave us no hope. But as the days progressed in the NICU, there was slightly more hope. And then we found out about the specialist. But still, my aunt was incredibly helpful to me because, even when we had hope, we were still, the likelihood of her passing was still high. It was above less than 1%. And so my aunt and I really leaned on each other a lot. And we still do, because, and honestly, like, I don't, it sounds fake, but my best friend also lost her husband and her father in a plane accident in 2014. It was, her dad had a private plane, and the landing gear, he wasn't flying it. A friend had actually been flying it, but he was in the plane, and the landing gear didn't. So I actually did have a support system.
Wow. Okay.
So
some of your closest people had gone through some tremendous losses, and
yes,
in some way were able to feel feel what you're sort of going through. Okay.
Yeah. And it was, like I said, I don't want to say I'm lucky for that, because it was terrible. You're not supposed to experience things like that. At least tragically and unexpectedly. Obviously, everyone goes through loss. But it was, I don't want to use positive words for other people's losses, but it helped. They just helped a lot, because they just had these hugely traumatic things. And I will say that I withdrew from a lot of my other friends, not in a mean way. They didn't, like, nothing happened, but it's just, there's a point where you can't talk about something terrible one more time. And they get it. They know that you're going through like the worst thing you can possibly go through. And like, my friends, at least, tried to be respectful of that. And I did try to keep them in the loop, but really there was just, unless somebody understood, I could not be totally open with them. On some level, them not judging me or being hurt by the fact that I could not interact with them in the same way, I really appreciate. Like, we are currently, in my opinion, rebuilding relationships that I essentially had to put on hold through the treatments. Telling people repeatedly just was a trauma in and of itself. And I mean, and like I said, they knew it. They knew the diagnosis. They had the internet. Like, they saw the things we saw. I mean, the only difference was it wasn't their child. So like I said, I guess they gave me grace in not being mad at me for not being able to include them like I would, because these were some of my best friends. And thank goodness they were still there when I had the bandwidth to re-engage. And I mean, I didn't cut anybody off. But because, like, they still checked up on us, they shared all of our stuff. There wasn't some end of friendship, but it was just like, I could not be the person I was. And I couldn't even be I couldn't even be myself, except around people that had these extreme losses.
I can imagine that month must have been like, you're just in a daze.
Yeah.
You're just kind of on autopilot, trying to get through the day, like eating food because you have to sustain yourself and staying alive, but not because you're actually hungry.
Yeah.
Is this the time that you found the support group on Facebook? How did you go about finding these people?
I probably found it about a month or so later. Maybe not. Yeah, it was probably about a month. And I had just been Googling it, and there was a lady who was in Georgia, not far from us. She wasn't super close, but not far. And I saw that somebody had written a newspaper article about her son. And I messaged her on Facebook, and she called me and she told me about the Facebook group, and she talked to me for at least like an hour. And I mean, she really, that was a lifeline. Um,
So her son experienced the same condition?
yes.
Okay.
Um, and I can't remember. It's been so long. She got a lot less active in the group shortly after I joined. Um,
Mm-hmm.
but her son, I think he was doing pretty well. So I would have imagined so the original high risk OB we talked to was at this other hospital. They were not directly affiliated with CHOA. So
Mm-hmm.
he could have gone through CHOA, but still the lady at CHOA, oh, I remember why he wasn't treated there. He was treated by the same doctors we had in New York.
Okay.
So that's why she had said there weren't very many good outcomes, or essentially any good outcomes from CHOA. It's because he'd been treated in New York. But yeah, so she was one of the first people. I mean, I think we had already been in contact with the people in New York, but just
Okay.
talking to somebody over the phone, we hadn't met any of them because they
Mm-hmm.
said, based on Mary Catherine's imaging and her stats, I guess, right then, she wasn't in immediate danger. Uh,
So the doctor in New York, you sought him out yourself? You found him yourself on the internet, or somebody put you in touch with him?
um, we pretty much, well, we pretty much did it. However,
Okay.
in the NICU,
Mm-hmm.
there they were really trying hard to get us to stay at CHOA. And I think it's because they probably thought Mary Catherine had a better chance. Like
Mm-hmm.
hers wasn't immediately dangerous. Hers had a lot of feeders, so it couldn't be closed as quickly. However, because there wasn't like a super large one, they could spread it out. So it both made
Okay.
it drew out the process, but it made each individual surgery less dangerous for a child that had like one major feeder. Um, so it was kind of good and bad. Um, and so they really wanted, I think they wanted her to be like the poster child for CHOA, and so they were pushing us hard. However, one neonatologist stepped into a room one day when nobody else was in there, and he said, "Do not stay here." He
Wow.
said, if it was my child, I would take them to Boston, Philadelphia, or New York. He didn't tell us anything else. And so that set us on a path. And eventually, CHOA
Just to be
really,
clear,
mhm,
just to be clear that I'm on the same page. This was
yeah,
before your daughter was actually released. This was after she was
this was
born.
like
She's in the NICU
day
for
3 or 4.
11. Okay, got it. Okay.
Yeah. Um,
So this doctor comes in and tells you to go to just a
yeah.
different city.
Yeah.
Okay.
He's like, do not stay here. And there was no couching the words. I mean, he was just straightforward and said, if it was my child, I would go to one of these places.
Okay.
Um, and we appreciated it. Um, we really did appreciate it. I mean, he's another one that just, we don't necessarily think about him a lot, but it was vital to how well our daughter's doing now.
Mm-hmm.
And then we did have another appointment with an interventional radiologist who is the type of doctor that treats these kids, at Emory, who is, that's the major school affiliated with CHOA. And
Mm-hmm.
Emory has a very good medical school. But that doctor even said, and I guess he also confirmed that we weren't going to stay because he was like, I mean, I will do the surgeries, but I don't focus on pediatrics. I'm primarily an adult vascular
Okay.
surgeon. And then we really pressed him, and he was like, if it was my child, I would go to Dr. Berenstein in New York.
Okay. Okay.
Um, and so just another one that, like, and we had already been leaning that way. I think we had already sent our scans to both Dr. Berenstein's team at Mount Sinai
Mm-hmm.
and to Dr. Orbach's team in Boston.
Okay.
Um, and we weighed them. Honestly, I don't really know why our hand was tipped. It might have been just the Dr. Berenstein's team responded more quickly. Both are great doctors. And I've met Dr. Orbach, and he's a wonderful person. So I don't, you know, there's no I have no competitiveness.
Okay. Okay.
But we made our choice and we went to New York. And when it changed for us is, and I couldn't even find this on the internet. It's probably just in medical school textbooks. But when a child is around 3 or 4 months old, the amount of CS fluid or brain fluid they produce increases to an adult level.
Okay.
And so a bunch of vein of Galen kids have to get surgery around that time frame, because all of a sudden that drainage system, it's got more pressure from the increased level of brain fluid, that's when you start seeing symptoms. And that's how it was for us. Because she got CT scans and MRIs. In the beginning, it might have been every week. And then they backed it up to like once a month, I think, 2 months, 6 weeks, 2 months, somewhere in there. And at the 3-month point is when they saw that her ventricles, the spaces in her brain, were increasing.
Okay.
And
At which point did you go to New York?
At 4 months.
4 months. Okay. And during these first 4 months that they're monitoring her, what are they seeing? Like, is it getting worse? Is it getting better? Is it just kind of like doing nothing?
We couldn't tell anything. And,
Okay.
and the margins that the ventricles were increasing, and maybe they weren't prior to that change in the amount of brain fluid. I guess when we saw them compare at the 3-month mark compared to the 2-month or whatever, you could marginally see change. But again, we were, compared to some people, not novices, but we were not trained to read these imaging, you know.
I think as most people who are not medical professionals, would agree with you. Yeah.
But we trusted our team. We liked them. We were being followed at CHOA. And Dr. Berenstein and his right-hand lady, Michelle, were just corresponding with us through email and phone conversations. Okay. And so it was really weird that we had this, the people really responsible for the rest of our lives we'd never met, and we're just kind of these
emailing each other.
Yeah.
Yeah. The modern world is so weird sometimes.
Yeah. But then we had to go up there, and we were in the Ronald McDonald House, and it was just so weird because Mary Catherine looked healthy, and we were just surrounded by kids with cancer, and it's harder to tell sometimes, but it really, being in the Ronald McDonald House, really, I mean, we knew it. We had been miserable. I mean, I don't want to say miserable, but like just so scared. We started to feel a little bit better around 2 months because the mortality rate during surgery increases. Or decreases, sorry, after about 2 months. But it was just scary, like being in this place where, kids are dying. Like you're there because your kid is dying. And I mean, there are people from all over the world there. I mean, plenty of them did not speak any English, but yet there was this immediate connection because your kid is dying. Like everybody, you can just relate to anybody that's there.
Of course, the connection that everybody feels that nobody wants to feel, but that's just the reality at the moment. And okay, so you arrived to the hospital in New York. So now you're meeting Dr. Berenstein in person, and this is the first time he's taking a look at your daughter. What's happening from there?
I mean, surgery essentially immediately. We had a couple of days. We had a couple of days for appointments because in case anything went terribly wrong, they wanted us to meet all the doctors. So we were all over New York, like uptown, downtown, whatever, all over Manhattan, I guess. And we met with the neurosurgeon in case brain surgery were required. We met with a cardiologist, a neurologist, just so many appointments. And then it was time. And we were there first thing in the morning. And I just remember talking to another patient waiting for surgery, and I can't remember what the surgery was for their child, but they were just, every surgery is scary for your kid.
Yeah.
But they said it, and then they're like, "What are you here for?" And it's like, oh, like, I mean, literally life and death.
Mm-hmm.
Because the scariest part about all this, I mean, there's no scariest part. It's all freaking scary. But the surgery could kill them. Like,
Yeah.
if the embolization went wrong, it could lead to a hemorrhage or a clot or just horrible, life-ending things.
Yeah.
And
They're incredibly
so,
fragile, so small. Yeah.
yes,
Bodies are still forming, of course. Okay.
um, and we just had we had no idea. Like, it was like a Hail Mary in football, you know?
Mm-hmm.
Just, she's the football that we threw to Dr. Berenstein and hoped he caught her.
Yeah.
On the other side, ridiculous analogy, but it was, it is. And it took so long. I can't even remember when it started, but it was early, and they got done at like 5:30, and it
It's
was
like an 8 or hour operation or something like that, right?
at least. And so the first part is the angiogram, when they just take the imaging and stuff.
Mm-hmm.
And then he came out. I can't even remember. It was sometime in the afternoon and gave us an update. And then that's when they actually do the treatment.
Mm-hmm.
And they are literally putting medical grade super glue into a baby's brain to close off these bad blood feeders, or these, not bad, but dysfunctional
Mm-hmm.
um, blood vessels. And there's one type that's called onyx, and you can smell it afterwards. Like, it's in the baby's brain, but you can literally
You can
smell
smell
it
it.
on them. And it was horrible. Like, just
Yeah.
waiting. And we'd, you just love your child more every day.
Of
And so
course.
we'd had 4 months with her. And, we'd gotten hope. And then all of a sudden, I mean, not that we didn't have hope anymore during the surgery, but it's just knowing that what she's going through could kill her. But if she doesn't get it, she'd die.
Mm-hmm. Like there's no choice. Either you
No.
do nothing and she could pass away, or you do this and that could
Yeah.
happen as well. Okay.
Yes. And then also little things like this that we didn't realize at first, but we learned later, the angiogram has radioactive dye contrast. Um,
Okay.
and it can cause the hair to burn on the back of their head
Mm-hmm.
um, where it's the closest to it. And
Okay.
I mean, some of that comes from babies, because they rub the back of their head on
Mm-hmm.
beds and stuff, but Mary Catherine's persistent. And then somebody finally asked about it in the group, and it's because it's like hair, it's like radiation burns on their hair.
Wow. Okay.
And it's not always terrible, but just until she was done, she always had kind of like a frizzy spot right there. And it's just like a reminder, things are not normal. Um,
Yeah.
I do want to say one thing, just it's so important to go to specialists, and for obvious reasons, but
Mm-hmm.
also when we were in New York, our daughter, she didn't officially she had borderline hydrocephalus, but still it was worrisome, and that was the reason she needed surgery.
Mm-hmm.
But we were told she likely had some gray matter, or I can't remember, I think it's gray matter loss, like around on her frontal lobe,
Okay.
because of the space between her skull and her actual brain. And she was doing okay. So it's like, this will be a problem we will face at a later date. But we got to New York, and we'd seen plenty of neurologists, um, in Atlanta and stuff. But what I don't know if I asked about it, or she was about 1.5. But the doctor was like, "Oh, that's called frontal bossing. It is when the brain, as a baby, essentially, it knows that additional room is needed, and
Mm-hmm.
so the forehead will just get a little bigger to create space. I mean,
Okay.
if you've seen a child with hydrocephalus, you know what I'm
Yeah.
talking about.
Mm-hmm.
But
Mm-hmm.
because of that, it was just kind of naturally more increased space between her brain and her skull, and that she did not personally think that there was any frontal lobe brain damage.
Okay.
Um, and just hearing that also, even though, I mean, it was so low on the totem pole for, when you're fighting for her life,
Mm-hmm.
you'll take what you can get, but at the same time, it was just like, that was such a huge relief. Um,
Okay.
and yeah,
So
but,
after she got the surgery in New
mhm.
York, um, how long do you have to stay in New York now for a period of time? And also, aside from dealing with the issue at hand, there's the financial elements of having to go to New York, of having to stay. Um, if you want to talk a little bit about, like, were you guys staying with friends? Did you have to stay at a hotel? I'm sure that's like another set of challenges right there. What was that like?
Mount Sinai has, like, they work with the Ronald McDonald House all the time.
Okay.
So we stayed there, and I
Okay.
mean, it's cheap for New York, and I mean,
Mm-hmm.
it's cheap to stay anywhere.
Mm-hmm.
But still, like, if you had to stay there a long time, it was, I think at the time, $35 a night.
Okay.
Um, and it was recently renovated. Our first day, it was really nice, all things
Okay.
considered. Um, but $35 a night, which again, not a big deal at the time, but like if
Mm-hmm.
we stayed longer, it would add up. Um, but luckily, this kind of surgery, if it goes well, you're essentially done. Um,
Okay.
and but you do have to stay there for, they like 2 nights, just to make
Mm-hmm.
sure that there's not going to be a stroke,
Okay.
or other immediate thing. But after those 2 nights, we could just go home, since she had no. And we were really lucky. She ended up having 9 angiograms with 7 embolizations. I don't know actually how many blood vessels were embolized, but like, she had at least one embolization for 7 of those angiograms.
Okay.
Um, and at first it was every 3 months. So her first five sur I think her first 4 surgeries were 3 months apart. The fifth one was about 6 months after that,
So
maybe.
you have to keep coming to New York
Yes,
every
over and
single
over.
time for these surgeries. Wow. Okay.
We would stay there for about a week,
Mm-hmm.
just to give time to rest a little bit, make all of those appointments, the surgery, the 2 nights, um, and then we'd go home.
Okay.
And yeah, I mean, it was expensive. We luckily are, I mean, financially okay. So
Okay.
it was a lot of money, but we managed it. Um,
Okay. Did your insurance cover anything?
yes, at first.
Okay.
That's a whole nother story. But we actually were very lucky in a lot of ways. My husband and I both have great insurance.
Okay.
I'm a federal employee. He
Okay.
is similar, but not. And so they were out of network, but we hit this very specific level of rarity where there was not a specialist within 100 miles, but there were known specialists. So, because it wasn't within 100 miles, we were covered out of network. Um,
Okay.
and there was a specialist, so they would cover to some degree that specialist. There were some insurance problems towards the end, because I don't know what happened, but some portion of Mount Sinai stopped taking insurance for a little while. I don't
Mm-hmm.
know exactly, but we really did not have to worry about it a ton. Now, the first explanation of benefits are terrifying. Um, like, I imagine for every family, because I didn't pay attention to them before, so I was
Mm-hmm.
kind of like anticipating bills. So when I opened it, and then I did realize that this was just the explanation of what happened. It wasn't a bill, but the surgeries are crazy expensive. Um,
Yeah, I could only imagine a specialist, one of like the handful
yeah,
that actually does this.
yeah,
Yeah, that must make for some like astronomical costs without
yes.
insurance and even with.
Well,
Okay.
they also, just like a lot of people complain about now, the amount they charge you can be different depending on your insurance and whether or not you have it and all this. So it is huge, but
Mm-hmm.
I think it is higher when you have good insurance because they know your insurance will pay more.
Because they'll pay. Yeah.
Yeah. Um,
Okay.
but
Okay.
like I said, we were lucky in that. We were lucky in that our jobs were flexible with us being able to take leave to go take her places. We were,
Mm-hmm.
like I said before, about the shape of her malformation. We were lucky in that, yes, it lasted forever. She was not cured until right before her fourth birthday, and she had to have one more after that to confirm that it was actually closed. So we had, I, there are at least 3 kids that have had more surgeries than her, but she's up there with how many
Okay.
she's had. But still, it made the surgeries a little bit, like each individual surgery, a little bit less risky, I think.
Okay.
Because there are kids that do have horrible complications after the surgeries, and we never had that.
That's
Which
awesome.
is
That's really great.
which
It's
is
like
so
some sort of something, some hope to hold on to. So when you were in a hospital there, is that did you meet Daniela in person
I
at
did
the hospital? Okay.
when Cecilia was in the hospital, because so
Okay.
Mary Catherine's older than Cecilia,
Okay.
by 10 months. No, something like that, around 10 months,
Okay.
9 or 10 months.
Okay.
And of course, that was a horrible time in her life as well, because it was, Cecilia was in the hospital then. But it was, despite all that, it was kind of wonderful. And so a lot of people are like, how did you trust your internet friend? But actually, during the pandemic, when my younger daughter, who's now 2.5, when she was 3.5 months old, I asked Daniela and her family to watch Alice because because she could not, they did not allow her in the hospitals. And so Daniela and her mom and sister, and obviously Peter too, because he was there. Like Peter came to get her from
Wow.
us in Manhattan, and they'd already left. Or I think they'd already moved out. Yeah, and they watched Alice for like a day and a half.
That's so
This
cool.
3.5 month baby. And seriously, we were
Yeah.
like, you just gave your baby to an internet friend?
So wait, so just to be clear, you had met Daniela in the group and then you met her in person, right?
Yes.
That's okay, okay, okay.
Yes.
All right. She was
Yeah.
kind of internet friend, but you met her in person,
Yeah.
so it's
A couple of years prior.
yeah,
Yeah.
good enough. Good enough.
Yeah.
Okay.
Um,
Okay.
and Alice was such a jerk the first night she was with them. They said she was very nice the next day.
Okay.
But she was
like, "Mom, why did you leave me to internet friends? What's wrong with you?"
she's still a little bit like that.
Yeah. Yeah.
But that does show the strength of your connection. I mean, it's literally like people who go to war together.
Yeah.
It's life and death. You're facing the biggest crises of your life, and together. And it's just they really you can relate on such a level that, I mean, it's this weird codependent thing where
Yeah.
like their child is like your child or like your cousin. It's like all of a sudden this person that you do not know is like part of your family, because
Sure.
there is this in your head, there is sort of this like blur of, I don't know, it's like every child is representative of your child at that point because you've been through it.
For sure. For sure. And you kind of get a sense of where the parents are as well. And, even though it may not be identical sort of progression of condition, you
Yeah.
still have that safety of, these people more than anybody understand what I'm going through. So,
Yeah.
okay, that's so great. I'm so glad. I can imagine finding that group. I'm sure that was tremendous for you at the time. I know you just mentioned that your daughter had to continue having procedures all the way up until she was 4.
Mm-hmm.
Can you talk to me a little bit about how having this network of support now has helped you throughout all this time, and and also just how your daughter is doing now? I'd love to know.
She is amazing. She is just perfect. She's met every milestone. She seems smart. She's she's a little like she had a slight physical delay. But we think it was partially we just wanted to hold her all the time.
Right.
So
Yeah.
she wasn't doing enough tummy time. Um,
Sure.
but yeah, she's in gymnastics and dance and first grade, and she can read now. She does not want to read because she does not like doing things that don't come easily.
Okay.
But that's pretty true of everybody. She is sassy and thinks she's the center of the universe. And but I mean she's also sweet and kind and funny and all those other things. But it's just sometimes it is just amazing to see where we started and where we are.
Yeah.
And we also, because we moved twice during all of that because we loved Atlanta. We had such a great time there, but we wanted to be closer to family. And that
Mm-hmm.
was right before that was fall 2018. And so we moved closer. It turns out we still weren't that close to anybody. It just was closer than Atlanta was.
Where are
Um,
you located now?
we're near Greenville, South Carolina. So
Okay.
that's about 2 hours from Atlanta because I still go there for work
Got
once a
it.
week. And my sister lives in Greenville, and then I've got aunts and cousins around the area. And my parents actually ended up moving up here. I'd grown
Okay.
up in Charleston, which is about 4 hours from here, um, and 5 hours from Atlanta. And it's just really nice to have people around. But
Have you met any other people from the group in person?
yes,
Okay.
that was kind of my thing for a minute. There is another mom in Columbia, and that's where I moved in between Atlanta and here. And
Mm-hmm.
it was wonderful meeting her. My best friend, the one who lost her husband and father, she met somebody else and moved to Scotland. And so when I flew over for her wedding, there was a VOGM mom living in Germany at the time. So I went to see her and got to meet her daughter.
Oh.
I'm trying to think. Of course, there's another lady whose son who has VOGM is right around my second daughter's age, and
Mm-hmm.
that was wonderful meeting her. And so I've met in person. I can't even remember how many. It's got to be 7 or 8 other VOGM families now. And I do have to say, Marlena, just Archer is 7 or 8 months younger than Mary Catherine, a couple of
Mm-hmm.
months older than Cecilia, and she lived in Atlanta. Um, and that was really the beginning to like clawing my way back to normalcy, like having a real life friend going through the same thing. I mean, I'm not saying I'm back to normal, but it was just, you know, um, it just helped a lot. Of course,
Yeah.
she doesn't live in Atlanta anymore either, but
Yeah. No, it definitely helps to have people who share your
yeah.
experiences. And you've had a second child since then. Having gone through such a terrifying experience first time around, I can imagine you may have experienced some hesitation. How did you end up making a decision to have another child?
Honestly, the pandemic. Um,
Okay.
just we at the close to the beginning of it, we'd kind of settled in and we looked around and it's like neither of us are traveling at all.
Mm-hmm.
Mary Catherine is getting closer to 3. Um, maybe it's time. And it was just kind of this breather because her surgeries had slowed down a little bit and because neither of us were traveling and it was just, and we couldn't go anywhere. It was
Mm-hmm.
kind of like, you know what? This is our time. And I don't know why I didn't react badly to being pregnant, like trauma wise. The day of the delivery, there was kind of this really, I don't know, vertigo almost experience where like I've been here. And that's honestly sometimes with these major things that have happened with the whole journey, it was almost like vertigo. Like, because it's almost like a physical feeling of just
Mm-hmm.
shifting. And it was like, I've been here before. And then I realized I essentially didn't absorb anything from like the actual delivery. It was essentially like my baby might die. and everything else was background noise. And so I really like just noticed things that time. And I was actually mildly nervous about having another C-section. It's like, this is major surgery. And that was bizarre because it was definitely during the pandemic. But I remember people now talk about how sad it was that nobody could be around for their birth or delivery. And Chris and I were just like, this is a dream.
Well, it's funny you say that because I had my daughter in the midst of the pandemic. She was born in March 6th of 2021. And, this is my only child. And that's the only experience I have being pregnant and having a child is in the midst of the pandemic. So people were asking me, like, are you sad that your husband can come with you to, through the ultrasounds or your family couldn't visit you at your hospital? And granted, I wish he had come to the ultrasounds, but I didn't know the other way. So it was like, okay, for me, he didn't need to be there every time. But honestly, for the hospital, I so agree with you. After I had my child, the idea of having people come visit me now was like, no, I don't want anybody in my room. Leave me alone. It was like, in a weird way, it's almost like a blessing in disguise. I'm like, I'm glad we just got this 3 days, really taking in the family. Just like the immediacy of one another. So I hear you on that.
One of the weird upsides to having a child in the NICU, but also us being so close, is that we got rest after she was born through that whole thing, because we would be with her all day long, in the NICU, but we could go home because we only lived like 10 minutes from the hospital. And the going from kind of having, and all the nurses taught us how to be parents, but going from that, where we were so carefully taken care of, to actually just bringing a brand new baby home was also an adjustment, because we really, we had a soft landing into parenthood because of the NICU. I mean, excluding the obvious.
The soft landing that you can see now in hindsight. Just that initial confusion on like, how do you keep a baby alive? That it is, like I said, there are a lot of ironies in all of this, but the basic stuff that everybody goes through, that was slightly easier because of the NICU. So it was, we were like, compared to our first experience, it was awesome. And we actually, I'm not saying these were the best decisions, but they worked out fine. But at the time, so our younger daughter actually had 2 holes in her heart when she was born, but one was very common. I think that one's the PFO, which I can't remember what it stands for. But very common, usually goes away pretty quickly. And then she had a VSD, which is a ventricular septal defect. But the doctor said later, said it was small and midline, which apparently is the optimal location. And that he felt comfortable following it as long as the murmur went away by the time she was 6 months, which it did. But at the time, we're in this hospital. We have been dealing with Mary Catherine for years now, and the hospital doesn't have a NICU. Like all this stuff, and they're like, and so they were going to release us, and they're all of a sudden like, oh, well, we want to wait for the echo and get the results and stuff like that, so we want to keep you another day. And it's just like, wait a second, is she in danger right now? They said no. Do you think it's likely that she will be in danger in the next 24 to 48 hours? They said no. Like, will she be able to stay at this hospital if she is in danger? No. And it's like, we're not staying. Like, there is no reason for us to stay. Like, we have had a child with much more serious health complications. We will go to her pediatrician tomorrow. Like, you are not keeping us. And I think, I'm not saying they were being like any kind of ulterior motives, but at the same time, it's like, we are veterans of medical stuff. You are not going to get us worked up about this, Yeah. You're like Mama Bear at this point. You're like, there's nothing you can say to me. I'm going to do what I know is right for my kid.
We are going home. And of course, the next day, the pediatrician was just like, yeah, she's fine. And the murmur went away.
That's awesome.
Yeah. And apparently, honestly, it's one of the reasons to have vaginal birth, because apparently the holes are more likely to happen for babies. There, I guess something about the pressure. I don't know. Don't ask me for
Okay.
specifics, but
Okay.
yeah. So yeah, it was in hindsight. It was just like, yeah, we're like, you're
It
not
was
gonna do it.
nothing. It was
Yeah,
like nothing to you at that
yeah.
point. Okay.
But
Cool.
but
So
yeah. So
now, Mary Catherine is, you said she's 5.
6.
She's 6. Okay. And
Mhm.
so what is her status now with this? It's completely gone.
Gone.
She's healthy. That's
Yeah.
awesome. That's so cool.
We had some other stuff go on, and she's fine too. Like, um, she I swear we could be in a Southern Gothic novel. But she ended up having beta thalassemia, minor,
Okay.
luckily, so the trait. But we
Okay.
found out because she'd gotten several fevers within like 3 in a month. And so we took her to check her out for bacterial infection. And they're
Mhm.
like, so she either has this weird type of anemia or she has lead poisoning. And we're like, really? On top of everything else? But
And this had nothing to do with the condition.
nothing,
This is just like a totally
nothing to
different
do.
thing.
So
Okay.
yeah. And that is one of the biggest takeaways from all this. Your life can fall apart and things will still happen. Unrelated things. Um, but it turns out it was hard at first because just getting in with specialists, and especially being in Colombia then, where beta thalassemia is really common in like Mediterranean and Middle Eastern, and to some degree just Asian in general,
Mhm.
populations,
Okay.
which Columbia, South Carolina does not have massive populations of those specific groups.
Mhm.
So it took us a while to get an appointment, and it like thalassemia can be incredibly bad. Like
Okay.
sickle cell, it like regular blood transfusions, iron chelation, because part of it is that your body can't process iron correctly and it can
Mhm.
build to toxic levels. But the thing is that she only had the trait, or what you call minor, and so she wouldn't need that. But because it's not super common, we didn't know that for a couple of months. I mean, it was fine, but it was just one of those things that just life just keeps going on, even if you have
Yeah.
other stuff.
Yeah.
Um,
Yeah, no, I can imagine you had your hands full. Can you
yeah.
tell me a little bit about as you're going through all of this over the last 6 years? Like you said, life still goes on. You still have your work. You still have your personal life.
Mhm.
I don't know if you have pets, maybe. How are you and your husband just managing your emotions psychologically, handling all the things you need to do, and making sure you're always there for all the doctor's appointments? If you could talk about that.
My husband and I really did, like I said, we really turned towards each other. And
Okay.
he is not the kind of person who likes to discuss feelings. So we just didn't. But I mean, both of us knew that we were experiencing these massive feelings.
Mm-hmm.
Um, and for whatever reasons, or whatever reason, both of us had been through things that were very hard before, um, including like my cousin dying, and holding my friend's hand through when her husband and her father died. Um, and so we had practice. And that sounds absolutely awful, but it did make us, I think, more um, empathetic to each other.
Okay. Maybe
Um,
adaptable in a sense.
maybe, yeah.
Yeah.
And so we just tried to be really respectful of each other, and we didn't try to take our anger out on each other. I think we probably didn't get very angry throughout the process, because just like we had to use everything we had
Mm-hmm.
to make sure that we continued to function. And I also think both of us, um, we really tried, because the only thing we could control really was Mary Catherine's interaction with all of this. And so we tried to keep a brave face in front of everything. Like, we did not want her to see us cry.
Mm-hmm.
I mean, we discussed things when she was old enough a little bit with her. And I tried to, like, for the first anesthesia, when she was kind of aware, I did talk her through it beforehand. But like when I took her back there, I did not cry. I did not get upset. Like I cried after she was already asleep and I was leaving the room. Um, and we just tried to mask the worst stuff. And we somehow did it. Like she does not have terrible memories of the hospitals. She does not have fear associated with doctors. Um, but other than that, personally, um, I got a therapist.
Okay.
And I in the worst parts, I found this free app called Insight Timer. I mean, I pay for it now just because I love it so much, but it's a free meditation app.
Okay.
Um, and I listened to some mantras from people, and just to help me sleep, especially. And then also there were just some self help books really helped me, just because trying to figure out how to manage, because you would you just think about falling apart in trauma, but you have to
Yeah.
keep going. And so self-help books really did help me structure it, like internally.
Mm-hmm.
And one thing that was huge for me was this book, A Monster Calls, and they made it into a movie. And it's only about a 4.5 hour listen, because I listened
Mm-hmm.
to it driving to and from Atlanta when I was
Mm-hmm.
working. I mean, I'm still working, but no. But it is it's about a little boy whose mother is dying of cancer, and he anthropomorphizes a tree into this monster that teaches him lessons, and like tells him stories. He teaches him lessons by telling him stories, and it helps you. It really was kind of cathartic, and helped me internalize that you can have two seemingly mutually exclusive things, which are, I want this to be over, but I want my daughter to live. Um, because it's just so incredibly painful. And it's like
Mm-hmm.
I can want both of those things that seem, if it's just over, that could mean she's dead. And but I don't
Yeah.
want that. Obviously, that is like literally the last thing I want. But it
Of course.
really helped me work through that. Like it's okay for me. Like I had to learn to forgive myself for wanting it to be over.
Yeah.
Um, but I mean, in any hard situation, you don't want it to last forever.
Of course.
Um,
Like waking up every morning and just like remembering the reality of what
yeah.
you're waking up to. Yeah.
And that was especially hard, I think, for me compared to like Marlene and Daniela, because both of them, their journeys were so much shorter. And but I'm
Okay.
not saying they were easier. Their children both experienced things that Mary Catherine didn't. So I'm
Mm-hmm.
not. There is no comparing. But like ours just lasted so long. Like we did
Sure.
not know she would ever be done until she was probably 3. Um, and just the idea of the shadow hanging over you for potentially your child's entire life, not
Yeah.
knowing. And I mean, and honestly, it's still there because she's cured, but she's
Mm-hmm.
had way more radiation than the average child. Um, she's got medical grade super glue in her brain. Um, just there are all these things, and you know, she had a brain condition and had brain surgery, and like
Yeah.
maybe there are going to be minor things that you are just really subtle so you wouldn't notice at first, or like maybe there are long-term complications, like the oldest kids that were successfully treated are about 30 now, so
Okay.
there are just still all these things. But I guess both my husband and I are realists. However, it's like you can be a realist but kind of sort of choose to live as an optimist.
Of course. Take it one day at a time. It sounds
Yeah,
like that's all you can really do.
yeah, so we do that mainly, and we just try not to dwell. Um,
Of course. So your daughter is, she's kind of a big girl now. She's
hmm
6. Um, what is her take on this? I mean, I'm sure she understands, a certain amount of what went on. What what has she said anything to you that was, sort of like, wow, I didn't expect such depth of like understanding what was going on. How have you spoken to her about it? What has she said about it?
She asks questions every now and then. She
Okay.
hasn't really gone in, I'm trying to answer her questions without going into too much detail because I figure she'll ask if she wants more detail, and I don't want to
Mm-hmm.
overwhelm her, either
Yeah.
to make her scared or to just bore her. Um,
Okay.
but the biggest way I've noticed, and again, like I said, we just sometimes it feels like we're people that stuff happens to.
Mm-hmm.
But her friend died in February of this year. She got strep, and then she got pneumonia, and then it was septic.
Oh my God, from strep.
Yes. And the biggest way I think it affected her is like she actually has an idea of what it means for someone to die.
Yeah.
And so she, I wish somebody at the school had called me because she had, when I told her that morning, she sobbed uncontrollably. Um, but she recovered. And then at school, I said, Mary Catherine, you need to be really good today because your teachers, they're also sad. You know, your whole class is sad. So just try to be
Mm-hmm.
really good. And then she started crying again. And I figured since she'd stopped crying before, she'd stop crying again. She did not. She cried all day long at school. And that's why I wish they called me. But again, honestly, maybe it helped. The people at school were much more hurt by her friend's passing than I was. And so honestly,
Mm-hmm.
it might have helped for Mary Catherine to grieve with other people that knew and loved her. But
Yeah.
so the kids in her class, this is 5K, so they were between 5 and 6. She was 5 at the time. So a lot of them just didn't get it. And so I just think she had, from these experiences, an innate understanding of what it actually means, you know?
Yeah. She
Um,
clearly has a much deeper capacity for empathy and the understanding that, like the finite aspect of human life.
yeah.
That's what that sounds like.
And she's recovered well. I mean, and being 5 at the time, she still cried for occasionally for a
Mm-hmm.
while, but she really did. It is amazing just the resilience of children. She was probably within a week or two, she was able to discuss it theoretically and ask questions about what happens now. And the only hard part is we've had a rough summer, honestly, like several deaths. But I mean, like I'm not. It's not funny. It's terrible. But at the same time, it's like it's can it stop? I mean,
Like an absurd
yeah,
extent where you're
yeah,
like, what is this a movie? Yeah,
yes.
I hear you.
But because of that, Mary Catherine now has started to ask to see like the bodies. She's like, I want to see a body, and I'm like, no.
Yeah, like okay, a little too
Yeah,
far, a
like
little bit too far.
yeah.
Okay,
So because of all this, it's just made her a little bit morbid, because she's had to
okay,
deal with heavier concepts. She has an advanced understanding of mortality,
okay.
um, and she's grappling it with in the way that a 6-year-old would.
Yeah. Did she ever
Um,
ask you questions like, naturally because she has some understanding of what she went through?
yeah.
Did she ever come to you and ask questions about your younger child? Was she going through something like that? Anything from what she understands to be the early childhood things that she went through? Um, if she had wondered that your second child had anything like that, I'm curious.
She might have, but the
Okay.
way I think about it more is when she was about 3, before Alice was born, because she's about 3 years and 8 months older than Alice.
Mm-hmm.
Um, was when she was about 3, she just said we were driving somewhere, and she goes, "I have a lot of doctors." I was like, "Yes, you do."
Mm-hmm.
And then I just left it, and she didn't,
Okay.
you know.
Yeah.
And just later, she was like, "Did I almost die?" She was probably 4 or 5. I can't remember exactly when she asked that. I was like, "Yes,
Wow.
yes, you did, or you could have." And she was like, "Were you scared?" And I was like, "It's the scariest thing I've ever been through." But, I just reminded her, I was like, you're okay now. And then I really do, because of our like absurd level of recent events, I have just tried to say, when bad things happen, was it sad? Yes, but it's
Mhm.
like, are you happy now? Are things good now? And she says yes.
That's really amazing. I mean, I think your daughter has certainly a particular way of processing her emotions, which, you know, I don't think a lot of 5 and 6 year olds are at that level. So, that's kudos to you for being amazing parents and staying strong in the face of some of the scariest things that you could ever deal with in parenthood. And I'm so glad to hear that your daughter is cured and you have a second baby who's healthy.
Yeah.
And, you're out there inspiring other people,
I'm
being a
trying.
part of this group. Can I ask you a little bit about the nonprofit? If you could just kind of just give me like a little bit of info about how you guys started it, what prompted it, and
There was one summer, and Marlene will tell you her personal, and it really was, a lot of it had to do with this baby that
mm,
passed. Um, and it was just, if he could have gone somewhere else sooner. His mom was pretty young. Um, and just, it's so overwhelming. And it's really hard to both tell experts in their field that you don't agree with them are going to go somewhere else in the worst time of your life.
mhm.
And I mean, the baby might not have lived if it had gone somewhere else, but there was a much higher chance.
Mhm.
And that does happen. Like, you will get somebody to go somewhere else and the baby still dies, and that's horrible. But it happens less than the other way around. But anyway, so there was that baby, but then there were two kids who went somewhere that you would think would, I'm not going to say them because I don't ever want to get sued for, like, you know, libel or something, or slander. Um, but they should be good. They're a well renowned hospital and they should be good. But there have been no children that I'm aware of that have had successful outcomes. Like,
Okay.
the one child that seems to be doing well didn't ever have to have a surgery. And that is also incredibly uncommon. I've only heard of it like twice out of all of the children we've seen. But yeah, the rest of them did not have good outcomes. And then there were these two children where
So just to
they,
be clear, these
Mhm.
the other families with the other children, you're coming in contact with them through the group now,
Yeah,
right? The
through the
Facebook group?
Facebook group.
Okay.
Yeah.
Okay. Understood.
And they are being treated at a hospital that should be good, and you would assume that would be good for this condition, but isn't.
Mhm.
And they mismanaged them. One of them had a bad outcome in a surgery, and both of these children, their parents were told that they should essentially just let them die, give them peace and let them die. And we actually connected them, and one of them had just been, I don't know who told them to talk to a different doctor, but I can't remember. But anyway, one of them actually had finally reached out to one of the specialists, and we connected the two of them, and they both ended up going to a specialist. And one little boy, it was too much, and he ended up dying. I think it was 2 years ago now. Anyway, just because the surgery had gone poorly, and he, there's just a point when there's significant enough disability that other things don't function as well,
Mhm.
and he was susceptible to infections, and so it was really sad. But they gave, the specialist gave them a chance, like, and gave value to his life, and that it was worth fighting for. And the other little girl, because it had been ignored for so long, it was incredibly aggressive, and it took a crazy amount of surgeries, but she was honestly just recently cured as well by the specialist.
Okay.
And the other place had told her parents to let her die. Um, so that was big for me.
Mhm.
And that summer there was another little girl who Daniela actually helped get in
Okay.
contact with specialists.
So it started off with you guys were just individually helping families, like advising them from the group,
Yes.
like this is who you talk to, this is the questions that you asked. And then through that, you saw that there's clearly a need for like a more cohesive,
Yes.
like solution for this that people could go to and be directed and helped with funds.
Yes. And my goal initially was a website because the information was so bad. Like all of
Mm-hmm.
the stuff people were getting was just your child's going to die. That was
Yeah.
what the internet was hammering into your head.
Yeah. Like
If you
no hope
touched
whatsoever. Just no
none,
hope. Just give up
none.
right now,
Yeah,
basically.
exactly.
Okay.
And
Yeah.
so I wanted a website. It was really Marlena who wanted to make it more than that.
Okay.
And because we just couldn't deal with it anymore. So the Facebook group was amazing and it existed before us. I think it was started by some people in the UK. My toddler's home, just FYI.
Okay. No problem.
But yeah, so we were there, and the closest is almost like a sorority, but there are fathers in it too, but it is primarily mothers,
Mm-hmm.
and female caregivers. But it's like you have mentors or a mentor program, and
Mm-hmm.
you aren't assigned them, but you just when you connect with somebody that came before you, one of the most helpful things is to help somebody else. Yeah, so it's almost like mentors, and so you get people that have been through it, and they
Mm-hmm.
are helped by helping you, and you're obviously helped by all the expertise and everything. And so that was in existence, but we wanted more. We wanted because um we wanted to be able to direct people sooner to the
Mm-hmm.
specialist who could get there, and we wanted to be able to actually make it easier to get there by like giving them help money if we can. Um and that, like I said, that was largely Marlena, and that is where we've made the most impact. But it did start with one summer where we saw just a lot of tragic cases, and the two I referenced and the baby that
Mm-hmm.
passed were all treated at the same place. I don't want to go. I don't want to say who it is, but
Okay.
it was especially egregious because this is an excellent hospital.
Yeah.
Um,
And
and
that should not
yeah,
happen.
and
Yeah.
it's not far away from Boston or New York. And
Mm-hmm.
so they should be aware of people who have better outcomes and should be directing people to the places that have better outcomes. And I mean, I'm not going to say anything else, but in my opinion, it is at least personally morally wrong for them not to. But
Yeah.
again, not trying to slander anybody.
Yeah.
But yeah.
No, that's amazing that you guys chose to channel all this pain that you experienced on your in your own life into doing something helpful to other women, other families who are struggling with this out there and probably have no guidance, no information, or being ignored by the doctors. And,
Mm-hmm.
that's incredibly necessary. I just wanted to ask you, again, I'm so thankful for your time and for you
Mm-hmm.
sharing the story with me today. Why did you agree to do this interview?
Honestly, sharing my story now, I am. It's different now. It's not everything. So it's weird because we moved and we were treated in New York. Like
Mm-hmm.
there are no triggers around us. Um, and that's good. I mean, it makes life easier.
Mm-hmm.
But at the same time, it makes it like it didn't happen. And there's nothing visibly wrong with Mary Catherine, which is amazing, But at the same time, it's like it's even more so. The world's moved on, but here I am, just still working towards, you know, normalcy.
Mm-hmm.
Um,
Mm-hmm.
and so it helps to talk about it sometimes, but also, sharing strategies on how somebody overcame their hardship helped me in other cases. Um, and honestly, like the biggest one is the nonprofit. And I think that's what we should be, really, I don't want to say pushing exactly, but like we're helping people.
Yeah.
Especially Marlena. She is such a machine with that stuff. And it's been a struggle because surprisingly we get less support from our group than you would think we would. And I mean, we're full of people with PTSD. So I guess it's surprising and not surprising. But every inch that we've gained is from Marlena, like just scraping and fighting to be able to help these people. And I'm just both really proud of her and would love to see us continue to help people.
Yeah, that's awesome.
Yeah.
I think that's a great way to finish it off. You're clearly a person who's gone through tremendous challenges and have somehow still found a way to not only move on for yourself, but do something good to the world, for the world with it. And I think that's really, really admirable. And I thank you for connecting with me and talking to me about it. If you enjoyed this episode or have suggestions for other topics, please leave me a comment, send a message on social media, or email me. I would love to hear from you. Thank you for listening.